Hi, my name is Dr. Ellie Pack. Again, I'm a radiologist who's fellowship trained in breast imaging and intervention, and I'm going to continue our talk today on breast imaging with regard to breast cancer. In part two, we're going to talk a little bit about breast density and specifically what that is. So I know a lot of women have heard the term breast density or heard about breast density, certainly in the news, or maybe you've gotten a letter in the mail with your mammogram results and there's some mention of breast density. And I'm sure you're wondering what exactly that means. Well, just going back to what we were talking about before with regard to anatomy in the mammogram in part one, again, breasts are made up of glands and fibrous tissue, what we call fibroglandular tissue, as well as fat. Again, that fibroglandular tissue appears white on a mammogram, and fat appears black. Every woman has really a variable appearance or a different amount of fibroglandular tissue, that white tissue in their breast. So what is breast density? Specifically, it just refers to the amount of that white fibroglandular tissue that you have on your mammogram. So when we look at a screening mammogram, when I as a radiologist look at a screening mammogram, what I do is subjectively decide what category or what I subjectively do is place that mammogram into one of four categories, either fatty or scattered fibroglandular tissue, and those are considered not dense breasts, or heterogeneously dense or extremely dense. Those are both considered dense categories. So again, there are four categories, the first being fatty, the second being scattered fibroglandular tissue, and again, those are not dense. And then the dense categories include heterogeneously dense and then extremely dense. What's important to recognize is that in the United States, half of women will have dense breasts. So roughly 40% of those are going to have that category, that third category, heterogeneously dense, and another 10% are going to have extremely dense breasts. Again, this is a normal finding. I want to say that again, having dense breasts is normal. But there are some implications associated with having dense breasts. In the next segment, in part three, we're going to talk a little bit more about breast density, specifically what the implications of having dense breasts are. So I hope you'll continue to join me for that. Thank you.